In your morning medical news, a new study finds more people with type 1 diabetes are using GLP-1 medications like Ozempic. These drugs were developed for type 2 diabetes, and clinical trials specifically excluded type 1 patients. Despite limited evidence on their safety and effectiveness, many doctors are still prescribing these medications off-label, especially for patients with obesity. And new research shows your drinking habits today could impact your memory tomorrow. A study of 1,700 older adults found heavy drinkers face more than double the risk of developing brain lesions. Scientists defined heavy drinking as 8 or more alcoholic drinks a week. Even former heavy drinkers showed an 89% higher risk compared to non-drinkers. Moderate drinkers weren't in the clear either. They still had a 60% elevated risk of brain damage. And colorectal cancer is striking more young adults, often discovered only after it's advanced. Screening can detect or even prevent this disease. Some tests can be done at home. Mandy Gaither speaks with a gastroenterologist about which screening option might be right for you.
Overall, in the U.S., colorectal cancer cases have declined the past several decades. And while it's still more common for older adults to have the disease, the number of people younger than age 50 being diagnosed continues to rise.
Proportion of colorectal cancer in young adults less than age 50 has actually doubled.
Dr. Joel Sameter with Mayo Clinic says several tests can detect and potentially prevent colorectal cancer. Most major health organizations now recommend those at average risk of developing the disease to start screening at age 45.
The gold standard here is really colonoscopy, where we take a flexible tube which has a camera on it. It's inserted into your colon.
Since a colonoscopy is more invasive, Sameter says there are 3 others to consider. First, a stool-based test. It can be done at home. The sample is collected and mailed in. But he says this test is expensive, and if it detects something off, you'll still need to undergo a colonoscopy. Next, a CT colonography. He says it uses X-rays to reconstruct 3D images of the colon. It's less invasive than a colonoscopy and doesn't require sedation, but a bowel preparation will still be needed. Finally, a blood test. It looks for small fragments of tumor DNA when colorectal cancer is present, but he says it's less accurate than other screenings.
The one that the patient elects and actually completes, that's the best test for them.
Ultimately, a doctor will help decide which test is best for you based on individual risk factors.